For me, the biggest challenges would be that sickle cell is a disease that's unpredictable, and she could be playing and as normal, but she could be in the middle of some sort of sickle cell crises. There is a frequency of pneumonia and what is called acute chest syndrome, which happens when the blood is sickling in the lungs, and that is a complication that is fatal to children and adults if they get it. So sometimes you just don't know that they're sick until you kind of take them to the doctor and they tell you that something is going on. Working with having a child with sickle cell disease, the job I worked previously before becoming the executive director of Dreamsickle Kids Foundation, I was their first employee that ever had any connection to sickle cell disease. So they didn't really know how to handle that. And even with getting FMLA and such, like I'm aware and I've heard stories from other people, because a lot of people with sickle cell disease don't look like they're sick. So the time that I would have to take off, because she did start having complications, I could tell in the office, it was kind of like, well, her child looks fine. Is she really taking off because the child is sick, or is she just, you know, not wanting to come to work? So eventually I ended up losing my job behind the fact that there was a lot of absenteeism, even though I had FMLA. And I feel that it's because they didn't understand how sickle cell can affect somebody, and that it doesn't always look like the person with the illness is sick. So now I'm able to be home with her when she has her doctor's appointments, or if she needs to stay in the hospital for 3 days or a week at a time. I'm able to do that. Before, it was impacting me as far as my career with trying to take that time off.